Chris Collins, Director of Public Policy at amfAR, thanks for joining us today.
My pleasure.
Funding for HIV has been a big issue here in Vienna. There's been many characterizations of it, from decrease to flatlining to the administration saying it's asking for an increase in HIV funding. How do you characterize the state of HIV funding, specifically PEPFAR?
Well, I think the first thing I'd say is, I'm strongly in support of the President's Global Health Initiative, which would broaden and better integrate our response to global health. My concern is that what we're seeing in the President's budget request is a flatlining of AIDS funding. It's a 2% increase in the tremendously successful PEPFAR program. So we're kind of seeing an end of that scale-up of new resources that we need to respond to HIV. And I really worry that that flatlining undermines the President's worthy goals around his global health initiative. Take maternal and child health as one example. Maternal health is one of the stated goals of the global health initiative, and it absolutely should be. But HIV/AIDS is the biggest killer of women of childbearing age in the world. It's not clear to me how we can flatline the response to global AIDS when so many millions of people are in desperate need of treatment and hope to do better on maternal and child health. And by the same token, we've seen that where we have provided women with treatment, you actually see childhood mortality go down as well for a whole variety of reasons. So there are huge knock-on effects by scaling up and providing life-saving treatment to people.
Another issue that you have examined in terms of how HIV relates to it is health system strengthening. Sometimes these two are pitted against each other, HIV or health system strengthening. How have you found that they actually relate to each other?
I think it's really unfortunate that some people are pitting AIDS against health system strengthening. I mean, the response to AIDS has been the greatest health system strengthener in history. New resources have come in, and one of the effects that happened, of course, is before the response to AIDS really scaled up, we saw hospital facilities, all the beds were full with people living or dying with HIV. As soon as the AIDS response started scaling up, that meant that those hospital beds were now free to provide care to people with other conditions. In addition, the response to AIDS, a lot of the money that goes into AIDS care actually winds up building laboratories, building health facilities, hiring and training healthcare workers. So there's huge investments that go through the PEPFAR program. A significant percentage goes into health system strengthening. So I really see what we've seen through PEPFAR is a real health strengthening effort that's been quite successful. It's true, and I think anyone would acknowledge that in many parts of the world, we have health systems that were and are shaky. There's never been the investment in health systems that there needed to be. And so when AIDS resources came in and new services were being provided, yeah, for sure, that provided strain on some of those health systems. But what's really happened with the AIDS response is millions of lives have been saved. We've gotten more healthcare workers able to provide care they know can save lives, and we've been really growing health systems around the world.
Rights Here, Rights Now is the conference theme, and one of the big focal points here is human rights. How do you see, or what do you see are some of the top human rights issues as it relates to HIV?
Well, it's absolutely a critical issue in HIV and thinking about getting better public health outcomes in the response to AIDS. One thing I'm very worried about is we've never done enough to address the needs of vulnerable populations, including men who have sex with men and transgender people, sex workers, and injection drug users. For example, only about 1 in 20 men who have sex with men have access to the HIV prevention tools that they need. And there's a lot of reasons for that. Governments like to turn away from the needs of vulnerable populations. They're not politically popular. And it's often really challenging for people who are marginalized to use more generalized health systems. So a lot of times they're going to need more targeted services. I think that one thing we need to watch out for is that major donors around the world are now looking much more towards a focus on health systems in general and in government ownership of the response. And those are two trajectories that, of course, make a lot of sense over time. But we need to be cautious about what happens to vulnerable populations as those trends play out. Because we know, for example, male-to-male sexual behavior is criminalized in over 80 countries. So what is government ownership? What does the response for MSM look like in those governments as we move to more government ownership? And we know that vulnerable populations have a tough time on utilizing general health services. So as we move to a general health services approach, how do we make sure we maintain the more focused programs we have for those populations that need them? That's always going to be necessary, particularly when these groups are stigmatized. I think one of the answers on both of those counts is continuing the investment in non-governmental organizations that are trusted by vulnerable populations, that involve vulnerable populations, and that are able to reach them with the services they need.
And last question for you. Before amfAR, you co-founded the AIDS Vaccine Advocacy Coalition. There have not really been a lot of major breakthroughs in the vaccine, at least coming out of this conference. How do you see the state of vaccine as it's widely believed as necessary in order to end HIV?
We're absolutely going to need an HIV vaccine to bring an end to this epidemic. There's not vaccine news at this conference, but we did get hopeful vaccine news out of the Thai trial last year. I think it's a foundation for really learning what happened there and doing a better job of developing a product, hopefully that can be licensable in the future. But in the near term, I think it's important to point out this conference has been full of great news, very, very hopeful news actually, in terms of positive results on a microbicides trial, that a women-controlled method of HIV prevention that may not be ready for licensure, but certainly lays a foundation for future research to get us there. We're beginning to get in news on pre-exposure prophylaxis. There'll be efficacy results on PrEP early next year, and we're increasingly seeing the evidence of the link between providing treatment to people who are living with HIV and the prevention effect that you have from doing that. So all the research is pointing us towards real hope in being able to combat HIV at home and around the globe, and I think it points out a couple things. One is the investments in HIV research are paying off. It's time to boost that investment. If you look at U.S. investment in the National Institutes of Health, both overall but over in the AIDS budget, if you adjust for inflation, actually the value of that AIDS research dollar has gone down over the last several years. We need to continue to ramp up our investment in AIDS and all health research. And I would also say that about AIDS services too. You know, as Bill Gates has said, as Bill Clinton has said, we've seen tremendous unexpected results from our investment in the PEPFAR program and in providing HIV prevention and treatment services around the world. Really unexpected, profound results that have been game changers. It's not time, it doesn't make sense to be flatlining the response, either in research or investment in services, when we've seen such tremendous outcomes. And the response to AIDS really can and is a foundation for accomplishing the President's worthy goals under the Global Health Initiative.
Chris Collins with amfAR, thanks for joining us.
Thank you.